السلام عليكم ورحمة الله وبركاته. أعزائي طلبة المرحلة الثالثة في كلية طب جامعة النهرين. Today I'm going to talk about systemic mycosis. This is the third practical lab with regarding to the mycology sessions. And in this lab we are discuss some important dimorphic and monomorphic fungi that causes systemic mycosis. As we know, mycosis can be present or fungal infection, which also known as amycosis, can be present clinically in three general manners. Either cutaneous infection, cutaneous mycosis, for example, infection caused by dermatophyte, or subcutaneous mycosis, such as infection caused by Sporotrex species, and systemic mycosis. This is the major clinically present classification of mycosis, either cutaneous, subcutaneous, and systemic. Of course, other classification such as superficial infection and opportunistic infection. So mycosis either cutaneous, subcutaneous, and systemic mycosis. So systemic mycosis either occur as a result to the infections with primary pathogens, primary fungal pathogens. When I said primary fungal pathogens, that means this fungal or this fungi have ability to overwhelm the immune system in immune competent individual. So it is pathogenic itself, have ability to overwhelm, to overcome the immune system in normal individual, in normal host. While the second type of systemic mycosis can result as a result to infection with opportunistic fungi and mainly or particularly occur in immune compromised patients. That means systemic mycosis occur either in immune competent in addition to immune compromised patients. And as we know, fungi either dimorphic fungi or monomorphic fungi. Dimorphic fungi such as Histoplasma capsulatum, Coccidioides immitis, Paracoccidioides brasiliensis, Blastomyces dermatitis, and Sporotrex schenkii. And we know what we mean by dimorphic fungi. It means fungi have ability to grow in environment and in host tissue, in environment condition and in host tissue. That means it's have ability to grow inside the tissue 37 degrees centigrade and also in 24 degrees centigrade. And this is usually initiation infection either by spore inhalation or by direct introduced to the body through the trauma or skin abrasion. While monomorphic fungi including Cryptococcus uniformis, Candida albicans, Aspergillus fumigatus, Deutericum, Actinomyces, and Nocardia. The first group that causes systemic mycosis is Histoplasma species. Which causes disease histoplasmosis or Ohio Valley fever. This is a dimorphic fungi. It's for two types of asexual spores. Either tuberculate macroconidia, tuber, tuberulate macroconidia, which is have a distinctive morphological feature. Tuberulate macroconidia, typical thick walls with distinctive morphological feature like finger-like projections. As a result, this type of asexual spore, tuberulate macroconidia, used in the laboratory identification of histoplasma species. So this is a sexual spore. While the second one, microconidia, which are smaller, thin, smooth whorls spores, and it is responsible for initiation of infection. So it is a contagious stage. It is a contagious stage, that is initiation or can be inhalation from soil to the individual and initiate the histoplasmosis infections. So we have two asexual spore in case of histoplasmosis, either tuberulate macroconidia and the mycoconidia. And as we know, histoplasma either have two varieties, either histoplasma capsulatum and histoplasma WCI. This figure show tuberulate macroconidia, mold form of histoplasma capsulatum with distinctive morphological feature. You can see finger-like projections, while the second form, yeast form, tissue form, which is microconidia inside the reticuloendothelial system, and can be identified or detected by biotic acid shift. This is other figure show the macroconidia inside the tissue of histoplasma species, while this is a figure show histoplasmosis inside the macrophage. This is other figure show mold form of histoplasmosis with distinctive finger-like projection. مهم هذا السلايد. finger-like projection. Laboratory diagnosis of histoplasmosis. In any laboratory diagnosis of fungal, you must firstly mention or know the type of specimen. In this case, in case of histoplasmosis, the type of specimen, either tissue biopsy or bone marrow aspirations, and the laboratory diagnosis either direct or indirect. Direct by using a special stain, or indirect by using culture media, in this case sebaroid dixose agar, and also we can use molecular technique and histopathological technique for laboratory diagnosis of histoplasmosis. Okay, now the other fungal infection, coccidiomycosis, caused by dimorphic fungi called Coccidioides immitis, and it is also there Coccidioides بوسوداسي. لأن أول ليش سموها بالكوكسيديوداس بوسوداسي؟ أول من اكتشفه هو بسنة 1891 طبيب بالأرجنتين اسمه إليخاندرو بوسوداسي. لهذا سميت باسمه. والكوكسيديودو mycosis either occur in immune compromised or in immune competent individual, but it is mainly occur in immune compromised patients, particularly HIV patients. So coccidiomycosis, it is also known as a valley fever caused by Coccidioides immitis. Coccidioides immitis. The distinctive morphological form of this fungi, block-like erythroconidia, or peral shape, block-like erythroconidia or peral shape in environment. It is found as a block-like erythroconidia or peral shape in environment as a free living, and found as a spherical erythrospore in tissue. هاي الصور راح تشوفون هنا الكوكسيديودس إميتس بيرال شيب أريثروكونيديا كمولد فورم، والتيشيو فورم راوند spherical contain endospore. round sphericals contain endospores. إذا هاي هم عندنا صورة المولد فورم مهمة كبيرال شيب. أجيب لك سؤال identify, give one reason for your identification. تقول لي هاي Coccidioides immitis. Why? Because it is peral shape erythroconidia. This is other pictures for Coccidioides immitis inside the neutrophils. مثل ما عرفنا هو الكوكسيديودس إميتس اسمه أيضا فالي فيبر أو بوسوداسي ديزيز. أول طبيب هو ليخاندرو بوسوداسي بسنة 1891، وأول مريض أصيب بهذه الحالة وشخص هذا الطبيب هو دومينغو إيكوزارا، اللي تشوفون الهيد مالته هنا موجود لحد الآن محتفظين به بأحد المتاحف الطبية في الأرجنتين، لأن أول حالة شخصت بالكوكسيديودومايكوسيس. أول حالة شخصت بالكوكسيديودومايكوسيس هو مريض اسمه دومينغو إيكوزارا. هذا للعلم يعني هنا، وما أجيب لك عن صورته وأقول لك عرفه بس للعلم. One of the most complications of coccidioidomycosis, a disease called erythema nodosum. مثل ما تعرفون erythema nodosum, inflammation of the fat under the skin. It is appear as tender nodules in lower extremities. So coccidioidomycosis can be disseminated and involve the skin, appear as a maculopapular rash or urticaria, and then progress to erythema nodosum, which is inflammation of the fat under the skin, and appear as a tender nodule. Other fungi, Coccidioides brasiliensis, either mold form or yeast form. هاي صورتين مهمة. mold form, the distinctive morphological form in case of mold form of Coccidioides brasiliensis is piriform conidia, septate hyphae كمثرية الشكل. While yeast form in tissue appear as minerals wheels. Identify, give one reason for your identification. يقول لي هذا Coccidioides brasiliensis tissue form. Why? Because it is minerals wheels morphology. Also, Coccidioidomycosis can involve skin manifestation, appear as granuloma, Coccidioidal granuloma. This picture shows Coccidioidal granuloma of caused by Paracoccidioides brasiliensis. While in case of blastomyces dermatitis وهي سجلت بعض الحالات بالعراق هي الحقيقة tumor mimic infections كان سابقا يعني قبل تشخيص بعض الحالات بالعراق يعتقدون انه هو سكين تيومر لكنه برا ما اخذوا بايوبسي وجدوا انه هي البلاستومايسيس درماتايتس ايضا مولد فورم وتيشيو فورم. المولد فورم ايضا بيريفورم كونيديا لوليبوب while التيشيو فورم distinctive morphology واضحة كلش broad based budding yeast with big hole. Identify and give vaccine for your identification. قولي blastomyces dermatitis broad based budding yeast caused by blastomyces dermatitis. It is dimorphic fungi. Can grow in 37 degrees centigrade and 24, and it is also can causes skin manifestation, appear as tumor-like lesion. The last fungi in this laboratory is Cryptococcus neoformis, which causes many disease, particularly in immune-compromised patients, but it is also causes disease in immune-competent patients. Cryptococcus neoformis can cause meningitis called the cryptococcal meningitis, and also can cause pulmonary infection and called cryptococcal pulmonary infection. The main characteristic feature of this fungi, it is encapsulated fungi. So it is surrounded by capsule. The main distinctive features of this fungi, it is encapsulated fungi, can be isolated from the CSF because it is causes meningitis. So it is capsulated fungi and can causes meningitis, and capsule can be detected by using a special stain called India ink. تشوفون حضراتكم الجملة اللي موجودة بالأسفل some killer have pretty nice capsule. هاي الجملة توضح لك كل الباثوجين سواء كان بكتيريا أو فنجاي surrounded by capsule. كل الباثوجين عندها كبسول. some streptococcus killer klebsiella half haemophilus pretty pseudomonas nice Neisseria كبسول كريبتوكوكال. واضحة. أتمنى لكم التوفيق وشكرا جزيلا لكم.